here's a few tips to try to reduce your sciatic nerve pain that you may be having. And so what Kenzie's going to demonstrate is going to be a few stretches, and then we're also going to show you an active movement that you can do to desensitize the nervous system. So the first stretch that she's going to do is just bringing her knee to her chest. So just bringing the knee up to the chest. She can make this a little more advanced by bending and bringing her chin towards her chest, and she's going to hold that. You know, you start off easy, maybe all you can tolerate is a few seconds, and you progress from there. Then she just relaxes, and of course, then she repeats it. Then we're going to make this a little more difficult. She's going to take a towel, and she's going to put this around the bottom of her foot. She's going to grab a hold of the towel, lie flat of her back, trying to keep the knee as straight as she can. She's going to pull this back and hold it. And again, to make this a little more advanced, to put more tension on that sciatic nerve, she's going to bring her chin to her chest and try to hold it. Now that is pretty advanced, and that may be a little difficult for a lot of people, especially if you're having a lot of pain. And then she's going to bring that down. Now, another one that she can do is just bringing the knee. She's going to bend the knee and bring it across just like this. And that stretches over in the hip over here. And you know, the sciatic nerve can become compressed into the piriformis muscle. And so this is just a great way to stretch right here. She can take her other hand or this left hand and pull her knee over and just make that more difficult. We can add one of these little small balls. You can take a lacrosse ball. They have a lot of myofascial balls, and she can put that right under the glute or the back of the leg and just lie on the floor, just static. Just put this right under there. Just lie still and breathe, maybe 4 or 5 minutes, something like that, to try to what's called myofascial release the air, just relax the tissue. And then the other on this, we're gonna stay in the same position. I'm gonna show another technique is what's called nerve flossing. So what we're gonna do is she's gonna bring her leg up, keep her knee straight, bend her toes towards her, and then bring her chin to her chest. And then she's gonna go right back down. When she gets to the bottom, she's gonna point the toes, and then she's gonna repeat that. Leg comes up, toes go back, chin comes up. A little bit of what's called nerve flossing or neurodynamics for the sciatic nerve. Also, something that you can do at home if you're having compression there is you can take a belt or an ACE wrap, you know, provided that you don't have any blood clots and you're safe to do any of these techniques. And you can just wrap that around the leg if you're having that radiating symptoms coming down, and just that tension or that compression on there does really, really well as far as desensitizing the nervous system. This technique is a prone press up. I'm a big fan of this. And so all that she's doing is going into a lot of extension here. She's looking up at the same time to try to load these spinal segments to desensitize this area, the nerve roots, and may become inflamed and irritated. And she'll just repeat that. She comes up, she holds it 2 or 3 seconds, it goes back down. If it's too uncomfortable, you can't get on your stomach, you can do this against the wall just by simply leaning against the wall, arching your back, creating this sway or lumbar lordosis here. And like I said, just do that throughout the day whenever you have time. So that's a few tips for sciatic nerve treatment. I hope that helps, guys, and thanks so much for watching.